Hello viewers, you're welcome to another episode of The N.O.W Show. Wow, today's episode gives me a lot of excitement because I bring to you somebody I call an overcomer, a winner in all ramifications. Is an ordinary person doing extraordinary things. And I was so wowed when I met him. Today, I bring you the celebrity doctor, Dr. Lolade Diya.
Thank you very much. Thank you for having me.
Thank you for being on the N.O.W Show, Lolade. Wow.
I'm glad to be here.
We've been trying to do this. Finally, we're here. Wow, doctor.
Schedules have been very tight. So
I know. You know, especially when you're dealing with this celebrity doctor.
No, that's not the reason. That's not the reason. It's a pandemic, you know. The pandemic is everywhere and it's affecting everybody. So
I know. And you've been particularly very busy because the kind of doctoring that you do is very special, and I'm really impressed by what you do.
Thank you very much.
And I thought, you know, it's good for my viewers to see this person doing these extraordinary things. Dr. Lolade Diya is an occupational health and safety module facilitator. He's the Chief Executive Officer and Chief Medical Director of Celebrity Platinum Hospital, Lagos. He is a family physician, a certified cognitive behavioral therapist, certified clinical sexologist, and a member of the American College of Healthcare Executives, happily married with 2 beautiful children. So tell the viewers, what's the celebrity doctor all about? Remember when I first said celebrity doctor, I was like,
Okay, so
because I was afraid of the fees.
Thank you again for having me on this show. I would say I think I need to clear the narrative first.
Yes.
That celebrity doctor platform or the brand is not only for celebrities. The plan or the philosophy behind it is to treat every individual as a celebrity.
Treat every individual as a celebrity.
So as a point of note, I need to stress that I think, or I know for sure that my wife and my mom are the biggest celebrities in my life. Wow. So if I want to treat any other individual, I will treat them the way I'm going to treat my mom, the way I'm going to treat my wife, the way I'm going to treat my daughter or any other person that is very close to my heart. So, and I realized that in medicine generally, as a certified, board certified lifestyle physician, I realized that it is not only medications that heals the heart. It may just be a comforting word. It may be a listening ear.
Wow.
It may be that you are there when the person needs you. It's not necessarily medications. You go and do this test or one. So that is what I have based my treatment plan, or my what I call the treatment plan upon. It's about patient-based. I'll give you an example, ma'am.
Yes.
I realized that most doctors like to treat the disease. And they forget that before the disease, there was individual.
There was that person.
Yes. So it has to be patient-centered or patient-oriented.
Okay.
Yeah. If you do that, you will treat every individual the way they should be treated. Because I used to tell my team, so I'm raising a team. I'm raising a big medical team of entrepreneurs, doctors, nurses, physiotherapists, and all the like.
Wow.
What I tell them is that anybody who wants to go to a bank or goes to a hotel is happy, or goes to a food joint or a restaurant is happy. But anybody who comes to we doctors is either in pain, uncomfortable, angry.
We come to you because there's a problem.
Exactly. That's the word.
We're looking for a solution.
That's the word. So if you now transfer your problem on, if you put or propagate your own problem on their own problem, you are going to
double jeopardy.
Exactly. So no matter how bad anybody has issues and they come to me, I'm always receptive.
Very. Now, very. I will say that.
I have looked for a way to compensate or to cope with the stress that comes with it.
Yes.
Because I will not lie to you, a lot of people need help. And by definition of total health, it is I'll define it in layman's terms. It is the presence of total physical, mental, social, they just added spiritual well-being, but not only the absence of disease. Apart from the fact that people are ill or have diseases, if they are not sound spiritually, physically, mentally, or socially, they are not in total health. Or they don't have complete health. Yeah.
So complete health is a fusion of all those things you have mentioned
together, and not only the fact that there is no disease. So, and people need to embrace that. You know, I used to tell people who want to hear that you can afford to buy a house, you can afford to buy a car, you can afford to go anywhere for holiday.
Yes.
But how many people can afford to die?
No one can afford to die.
You can't. You know? And you know, the pandemic has actually opened my eyes to a lot of things. It has shown me that money or finances is a very, very important key when it comes to healthcare.
Yes.
But if you don't have the right people doing the right things, even the money will not be able to help you.
Wow. I need you to come again on that.
Yeah.
Financing is very important.
It surrounds everything.
Yes.
Yeah.
But if you
don't have the right people doing the right things, everything is. I'll also
give money now becomes irrelevant.
I'll give you an illustration. During the pandemic, there were people. They were initially speculating that respiratory ventilators were very important.
Yes.
Yeah.
Yes.
In places like America, where they could afford to buy ventilators, they realized that even putting people on ventilators was not as effective. Now, let's come back to Nigeria.
Yes.
Before you can put any individual on or put any patient on a ventilator, you need a specialist, an anesthesiologist, or an internist to be able to intubate, then put the ventilator on.
Oh.
Yes.
Seriously? Is that complicated?
Yes.
Wow.
So some people thought I'll just go. So I have patients who said, Dr. Diya, please get me 3 ventilators. I'll put in my house. They thought it was something they would just plug
and just place on your, like a mask.
It doesn't work like a mask. So there is a nebulizer separate. There is a CPAP separate. There is an oxygen concentrator. Those ones will administer oxygen normally. But a ventilator is an expensive medical equipment. Yeah, if you buy it and keep it, and you don't have the appropriate personnel to
run it,
it's a waste.
Wow.
Now, even with the appropriate personnel, there are complications of injuring the larynx or injuring the trachea when they are putting. So all these things are. So my point in general is, it is not the big hospitals. Yeah, it is not the nice hospital, not the big equipment.
Yes,
it is the people and the personnel and the skill, the amount of skill set that they have. It is people running it that makes total healthcare.
Wow, wow. And that is why you have carved a niche for yourself by bringing that total healthcare to us in our homes.
Yes.
Because that's what the celebrity doctor does. You don't want to go there, but that's what you do. I mean, it's
I want to explain what the practice is about.
Yes, yes.
So, if I may mention, my father was a doctor. Yeah.
Okay.
And he was
I was going to say, I mean, what made you go into medicine? Now I know.
So I was literally raised in a hospital.
Oh.
Yeah, my father was a doctor, my mother was a nurse.
Okay.
My elder sister is a doctor, my younger brother is a doctor.
Wow.
Yeah.
Wow. So it's a family of doctors.
Well, and we're all practicing.
Yeah.
So now what I decided to do was, I realized that slogan of "that's my family doctor, that's my family doctor," is nowhere to be found.
Yes.
That is one.
Yeah.
So I did my master's program in Capella University.
Yes.
And I realized that the reason why the UK, the US, the whole of Europe, and most parts of Asia are doing well when it comes to healthcare is because they have what I call GP-rized the system. GP, general practitioner.
Okay, yes.
Yes? So it will be almost impossible for you to walk into a hospital and say you want to see a hematologist or you want to see a gynecologist. You need somebody you can interact with first.
Yes.
Your primary physician.
Yes.
Yeah.
So is that primary physician that will now refer you to the specialist?
That you need.
Yes.
Your family doctor that we unconsciously erased from our system here. The reason why most of my colleagues are going abroad is because those systems have been put in place to meet the needs of everybody. Then if that individual or that patient needs some form of specialty, they now refer it to the appropriate person. So what concierge medical services, what it does is, I think we're just a few that do it here in the country.
Concierge medical services. I just like that.
No,
name.
But the word concierge, concierge has been there.
Yes, I know.
It's been there for a while.
Okay.
So what it does is we try to not flaw any medical ethic. Everything is still followed to the book. But we'll make it convenient to the patient.
Now, so it's convenient medical care.
Exactly. Convenient
because you bring it to me.
Yes, I need to add something. Experiential medical care. That word experiential is from experience. It is impossible, in all humility, it's impossible that I will have an encounter or a session with the patient and the person will not learn one or two things from me. Now, I just want to divert in this bit. If you go to a hospital, a general hospital, you see a doctor seeing 300 patients. Let me not be overboard. Maybe 100 patients a day. Now, there's a likelihood that the patient and the doctor will not have any, there's no experience between. It's just about, what do you have? Headache, fever, body pain. Just write it down. You have in his head, is that malaria or an upper respiratory tract infection or something?
They already have preconceived idea
in
of what each patient comes in with.
They'll just write the medication, so you give it to you and you go.
Yes.
But in my own situation, it's different. There needs to be an because that person may not necessarily need any of those things.
Medications, in fact.
Just listen to the person. But you know what? The timing is inappropriate. The facilities, there are health policies that are not in place to put all those things right. So we have tried to carve a niche to have a particular kind of target audience or target clientele that we attend to, and give them the best possible medical care, patient-based, evidence-based, patient-based, evidence-based medical health care services that they have, that they deserve.
You know what I will tell you? Somebody out there hearing carve a niche and so that we can attend to them and give them will think, that must cost some money.
Okay,
so tell us how affordable.
So now for the fees. For the fees.
Is this concierge medical services?
So what we're doing what we're doing now is, like I said, healthcare everywhere is expensive. From the master's program that I told you that I did, I realized that countries like Norway in Europe, their budget for healthcare can fund NASA projects in America like twice. That's in billions of euros. And each person has a medical insurance of more than 200,000 euros a year. So those people, the government of those people have invested hugely or heavily in the healthcare sector, in the healthcare space. Now in this part of the world, Nigeria as a whole, what we try to do is we are trying to, myself and a group of people. So what I did was I started interacting with people who are financially literate. The reason being that I wanted to carve out a business side from medicine. Because everybody just assumes that it's Dr. D and he's fine. It's okay. He doesn't need money. He doesn't. But I went to a private university. I spent over...
That's why you have all these ideas. Because I remember, the first time we met and I was questioning you because I was intrigued by this young man who, they had said to me, we'll come and see you at home. And I'm like, am I going to be able to afford it? No, you shouldn't come and everything like that. So
I'm still talking about financing. So what we are trying to do is we are trying to make sure, let me not use the word make sure. We are trying to ensure that your lifestyle, the things that you use normally will pay for your healthcare. I'll give you an example. There's a place in Indonesia, if I'm correct, or Taiwan, where you go to a supermarket, and you spend an average of 20,000 naira on groceries every month.
Okay.
For every 20,000 naira you spend every month, because groceries you need to eat.
Yes.
You must eat.
Definitely.
You must buy. You know.
Yes.
So for every 20,000 naira you spend on groceries, they give you 3,000 naira. It's an agreement between the medical protocol and the supermarket.
The grocery store.
Yeah. So you can, for every 20,000 naira you spend, you get your health. I call it healthies. It's like tokens. Yeah.
Okay.
So for every 20,000 naira you spend in grocery, buying food normally that you need, you get 3,000 in your medical insurance. I call it the e-health pin. So they open a health insurance for you. Yeah. If you spend more, you can spread it over to your family. I'll give another example. How much data do you spend? How much data do you use in a month?
Consume in a month.
Yeah.
Doctor.
No. Just okay.
Doctor.
Let me. What I'm going to do is I'll give an example. I use 20,000 naira unlimited. All the data that I use. Yeah.
Okay.
If I can remove 2,000 naira from 20,000 naira that I use every month, so it's an agreement between the my own medical protocol and the internet company. So it will be as a way of CSR. Yeah.
Okay.
I can't do without internet. My Zoom calls, my master's programs, everything I do is on the internet. Yeah. For every 20,000 naira I pay every month for internet, 2,000 naira is removed for my e-health protocol or my e-health insurance. Yeah. You can imagine having 1 million people 1 million is too much. 100,000 people on that internet medical protocal combination. So 2,000 times, you have to help me with my math. 2,000 times.
Direct medicine. I did it.
No, this is math now.
Yes.
2,000 naira times 100,000 people is how much?
200 million.
So those 100,000 people, that 200 million naira, yeah, will give you the first aid that you need. Yeah. Now with that first aid, I'm going to come to a couple of topics. Please remind me. I'm going to talk about reasons why you need concierge medicine. I'm going to come to 5 cancers no Nigerian should have. Yeah, and the reason why concierge medicine is affordable.
I know that we need concierge medicine because I know the level of work you did during the COVID period. I mean, a lot of people who hospitals didn't have the space to take, they were able to get the care that they needed because there were services like your services available. I know how busy you were, you and your team having to go to homes and everything like that. So, I mean, it's really commendable.
Yes.
And it's something which is needed in this environment because if good healthcare can come to you in your home, it's something which anybody would be grateful for to have because health is wealth, like they say. So if somebody is looking after my health to make sure that I am okay.
Okay. Now that brings me to the treatment model. Now, from research, I have realized that appropriate routine screening, immunization, and first aid, those 3 together, reduces hospital visits by more than 85%.
Wow.
I will give you an example. I'll use myself also. So as a 40-year-old young man who doesn't drink, who doesn't smoke, there are some investigations that I should do when I get to 40, depending on 4 things. My gender, either I'm male or female, my age, I'm 40, my past medical history, my father and my mother being hypertensive or diabetic, and my lifestyle. Yeah. So now these things for myself, now I'm going to do probably a complete blood count, check my kidneys, check my cholesterol levels, there's what they call metabolic syndrome. There's a metabolic panel that you do. You don't need to do it every year. It's just like putting your child in school for the first time, that registration fee is there. Yes. But after a while, when you have done the needful, what you just need to do is follow-up visits. Yeah. So if I do all those tests the first time, it can be a little bit expensive for the first time. Then after that,
or subsequent ones,
everything else, and it depends on whether you need it or not. Let me give an example, ma. Going to immunization now, I do a serology test and I check for hepatitis B. Yeah, female, I do a pap smear, and your hepatitis B is negative. As a right-thinking doctor, the ideal thing to do, even if you have taken a hepatitis B shot, is to give you a booster. Why? Research says that 96% of the times, what causes cancer of the liver, or what they call hepatocellular carcinoma, is hepatitis B. If I give you that vaccination, there is a 0 to 1% chance that you have cancer of the liver.
Wow.
You can rule that out.
Wow.
Yeah?
Wow.
If I do a pap smear for you and it is negative, I can decide to give you a human papillomavirus vaccine, which is what prevents people from having cancer of the cervix. So all these things are very, very important. If I do that, that is out. Yeah? Now, first aid. Coming to first aid. A lot of people think the first aid box.
Our doctors are aware of these things. It's a question to know.
My doctors are aware. And I think most doctors are aware.
Okay.
So I think it depends on how you that's why it has to be patient-based. If it's not patient-based, if it's based on, I want all my patients to come to the hospital, so I can make money. For people who are on retainer, I think I'll get to that when it comes to financing.
Okay.
For people who are on retainer, it's different, because at that point, just like how you have retainership with your lawyer, at that point, your life is in God's hands, but you have given me the opportunity to take care of you.
To care for you.
Yeah, exactly. To increase your life expectancy by more than 20 to 30 years. And that's what everything else I do is, it has to do with me handing everything over to God. Yeah, but at the same time, I'll do due diligence to ensure that the I's are dotted and the T's are crossed. That's how thorough I can be most times. So for the first aid, let me give an example, ma. Most of the first aid kits, cotton wool, spirit. How many
people even have first aid kits in the first place?
Everybody has retainership with me, has a first aid kit. So it is with the history.
Yes.
Just imagine if I have the history that there's somebody in this house that has a previous history of a cardiovascular, that's a heart problem.
Yes.
Yeah? Or someone has the history of ulcer, peptic ulcer disease, or someone has a history of asthma. Now, most of those first aid kits do not come with aspirin. But I can tell you for free that if somebody who has had a heart attack before, or has uncontrolled high blood pressure or uncontrolled hypertension, if a person wants to have a heart attack and you put 300 milligrams of aspirin just under the tongue before you call the hospital, there's a likelihood that you have saved that person's life.
So there has to be awareness.
That's very, very important. Now, for people who have asthma, they routinely will not put Seretide or Ventolin in the first aid. But I have the information that in this house, there's an asthmatic patient there. You put it inside, and everything is well listed on the first aid box. So before they even call you, your primary healthcare physician or whoever they want to call, they've done the needful. They've done the first aid.
Been able to.
Before the ambulance gets here, the person is getting relief already. We take them to a hospital. And also that the things that, and Caucasians, people in developed world, they don't play with stuff like that. And so those are the things that the concierge medical, you will not know how important having a headache or having a cough is until
so it prevents you from doing something very important
to you. You want to give a lecture or you want to go for a meeting and you'll not be able to do that. So those are the things I want to do. Like I said, the philosophy behind it is treat everybody like a celebrity.
Treat everybody like a celebrity.
It's very, very important. It's very, very important. You need to be warm. You need to be kind. You need to be able to give to others what you will give. Finish. And
Wow, Lolade. I'm so glad that we've spoken, we've done this, and I'm sure somebody out there has picked up something, because this is insightful, that there are different opportunities available to everybody. So you can decide whether you want to give this a shot or not. But I will commend you again for this team that you have raised, because you're making things easy for people. So access to medical care from my home, it's now available, affordable, and that is commendable. Thank you very much, and well done, well done, well done. So we have something that we do on the Now Show, which we call the last word. So if my viewers don't remember everything that we have discussed, that last word that you want to leave with them. So your last word.
So what we usually do is, at Lolade Platinum Consortium, we have the power to care and the power to heal.
Power to care, power to heal. Wow. So viewers, you've heard it all from the celebrity doctor himself, Dr. Lolade Diya. Like I said, being a celebrity doctor, he did say that it's not just to attend to celebrity, but to make everybody feel like a celebrity. Until we come your way again on the Now Show, bringing you another person who's decided to do extraordinary things. I am your regular host, Abosede Oza Osho, signing off with my guest, Dr. Lolade Diya.
Thank you very much.
Thank you, Lolade, for being here.
Don't forget to like this video. And if you haven't, subscribe to the Now Show channel today and hit the notification bell so that you do not miss any video that is uploaded. Thank you for watching.